Take a close look at this. These are the legs before, and these are the exact same legs just 2 weeks later. What changed? Only 5 minutes a day, two ordinary couch pillows, and one simple exercise that helps restore healthy blood circulation in the legs. My friends, if your legs feel heavy by the evening, as if you've spent hours standing in the kitchen, if your ankles begin to swell and the marks from your sock bands are still visible by dinner time, if small blue veins have started appearing on your shins and larger bulging veins are slowly climbing up your thighs, then this video is for you. Today, I'm not going to explain for the 100th time where varicose veins come from. There are already countless videos online about the causes, and most of you have probably watched many of them. Yet the pain in your legs remains. Why? Because a lot of people know the causes, but very few actually know what to do about it at home. So today, I'm going to show you one exercise. No machines, no pills, no expensive devices. Just you, two regular pillows, and a wall. This method has existed for more than 50 years. It's described in medical manuals, and its effectiveness has been confirmed by clinical studies. I'll leave the links in the description below. But first, an important warning. This exercise actively stimulates blood flow through your veins, and because of that, there are situations where it's better not to do it. If you've been diagnosed with deep vein thrombosis, blood clots, or thrombophlebitis, don't perform this exercise unless your doctor approves it. If you've recently had surgery on your legs or blood vessels, the same rule applies. Doctor first, exercise second. If you're over 45 and haven't had your veins checked in a long time, it's worth getting a vein ultrasound before starting. It's a quick and painless procedure that requires no preparation and is available in most clinics. It's simply a good way to feel confident before you begin. For everyone else who feels fine and doesn't have serious vein problems, you're ready to start. And one more small thing before we get down on the floor. If you find this topic useful, please like the video and subscribe to the channel. Every like tells YouTube that the video helps people and then more viewers get a chance to see it. That means one more person with aching legs may finally learn what to do. That's how we help not only ourselves, but others too. Thank you. Now let's get into the practice. You won't need much. A clear section of wall that's at least about 6 feet wide. This is important because your legs will need room to spread apart. A narrow space won't work well. Next, a yoga mat or simply a folded blanket. Lying on a bare floor is cold and uncomfortable, and we want your body fully relaxed. And finally, two pillows. Ordinary ones from your couch or bed, whatever you already have at home. All right, now let's move on to the exercise itself. Go over to the wall, place your mat directly against it. Put the two pillows on top of each other at the base of the wall on the mat. Now lie down on your back. Place your feet against the wall. Slide your shoulder blades along the mat. Move a little closer to the wall and rest your tailbone, the bony area above your buttocks, on the pillows. If you can't get into the perfect position right away, that's completely fine. Just lie down near the wall and gently slide the pillows underneath you. The main thing is that there should be no pressure on your lower back. And here's something interesting. The exercise has already started working, even though you haven't moved yet. Look at what's happening. Your hips are elevated, your body is relaxed. Gravity gently shifts your mesentery, the tissue that supports your internal organs, upward toward the diaphragm. Your pelvic area opens up. Blood already begins draining from your legs simply because of this body position. That's exactly why we lie like this. Rest in this position for about 30 seconds. Breathe calmly through your nose. And I know some of you are probably thinking, couldn't I just do a shoulder stand instead? The answer is no, and here's why. In a shoulder stand, your body stays tense, your core muscles are engaged, and everything is working hard. Here, it's the opposite. Your body is fully relaxed and the wall supports your legs. You can remain in this position for a long time without effort. A shoulder stand tires you out within a minute. Here, you simply lie down and let your legs do the work. That's the key difference. A couple more things before we start moving. If you feel slightly dizzy or notice a pulsing sensation in your temples, that's normal. It simply means blood is flowing toward your upper body. Stay there for 30 seconds. Stand up briefly, then try again. After a few days, your body will adapt. Okay, Now let's get the legs moving. Lift your legs away from the wall and spread them apart as wide as feels comfortable. Then pull your toes toward your face and bring your legs back together. So the sequence is spread, pull your toes back, close, spread, pull your toes back, close, repeat. The most important thing is to use the full range of motion, not half movements. That's the only way you'll really feel your calf muscles activating. This is the calf pump we'll talk about later. At the same time, when you spread your legs wide, the groin area opens up. And that's exactly where the blood needs to travel back through on its way out of your legs. Perform this movement for about 1.5 to 2 minutes so you can truly feel the muscles working. Excellent. Very good. Now that your legs are warmed up, let me show you how to increase the effect. We'll do something similar, but instead of opening and closing the legs, we'll draw circles. Keep both legs together and make large circles in the air as wide as possible. Do this for 30 seconds in one direction, then 30 seconds in the other direction. You'll immediately notice how this opens the groin area even more. And there's one more movement I definitely want to show you. The bicycle. I probably don't need to explain it. We all rode bicycles as children. Simply pedal in the air with both legs as if you're riding a normal bike. But there's one detail almost everyone forgets. First pedal forward for 30 seconds like usual. Then, and this part is very important, pedal backward for another 30 seconds in the opposite direction. That reverse motion activates muscles that regular pedaling doesn't reach. That's it. The active part of the exercise is finished. But don't get up yet. Put your legs back against the wall and rest there for 1 more minute. Keep your body relaxed and your breathing calm. It may feel like the workout is already over, but the effect is still continuing. Blood and fluids are still redistributing throughout the body. Your veins are recovering. That final quiet minute is just as important as the movements themselves. Don't skip it. There are a few more things that may surprise you. Your feet may become cold during the exercise. That's completely normal. Don't worry. In fact, it means the blood truly moved out of your legs toward your heart, exactly as intended. Just put on warm socks beforehand. And finally, here's how to come out of the position properly. Don't jump up suddenly. Bring your legs down from the wall, bend your knees, and place your feet on the floor. Roll onto your right side and stay there for about 30 seconds. Then slowly sit up. Remain seated for another 5 to 10 seconds before gently standing. The best time for this exercise is in the morning on an empty stomach before breakfast. If you do it in the evening, wait at least 2 to 3 hours after dinner. But there's another important point. Do the exercise at least 1 hour before bedtime, not later. Here's why. This exercise actively moves blood and fluid out of your legs, your kidneys begin working more intensely, and fluids redistribute throughout your body. If you do it right before sleep, you'll probably wake up several times during the night to use the bathroom. So evenings are fine, just not immediately before bed. How long should you do it? Start with 1 to 2 minutes. Don't try to push yourself too hard right away. Your body needs time to adjust to blood suddenly shifting from your legs toward your head. You may feel slight lightheadedness or pulsing in your temples. That's normal. After 2 or 3 days, you'll comfortably reach 3 minutes. By the end of the first week, you'll manage 5 minutes. And one more important tip. You don't have to do the full 5 minutes at once. If it feels difficult, split it into smaller sets. Lie down for 90 seconds or 2 minutes, then stand up for about 30 seconds so blood can flow back into your legs. Then lie down again for another 1.5 minutes. Repeat this 2 or 3 times. You'll get the same benefits, but most people find it much easier, especially during the first few days. This alternating process is actually useful because it trains your blood vessels to respond better to changing blood flow. And one final point about preparation, consistency. You should do this exercise twice a day, once in the morning and once in the evening. The morning session wakes your legs up and prepares them for the day. The evening session removes swelling and fatigue built up throughout the day. No skipping. If you want results within 2 weeks, you need to do it every single day. There's also one more way to boost the effect, a contrast shower for your legs after the exercise. And let me clarify immediately, no ice baths or extreme cold exposure. After age 60, that can be dangerous for the heart. Do it gently. Run warm water over your legs up to the knees for 30 seconds, then noticeably cool water for 15 seconds. Repeat for 3 cycles. Always finish with cool water. That's what helps keep the veins toned. This method is called the Kneip method, a type of water therapy used for more than 100 years. In Germany, it's still commonly used for vein care today. And a 2023 systematic review found that it may still no help. However, be careful. If you have high blood pressure, it's best to talk to your doctor first. So there you have it, my friends. 2 pillows, 5 minutes, and a contrast shower every day without skipping for 2 straight weeks. The heaviness in your legs decreases within 3 to 4 days. Swelling improves in about a week. Spider veins become less noticeable after 2 to 3 weeks. Larger veins shrink and stop hurting. Complete disappearance takes longer, sometimes months, but you'll definitely notice real progress. This isn't magic, it's physiology. You simply restarted a pump that had been inactive for a long time. All the studies are linked in the description below. Read them yourself and verify the information. Leave a comment and tell me which movement felt hardest and how your legs feel afterward. I read every comment. Simply knowing information changes nothing without action. And if this video helped you, don't forget to like it and subscribe to the channel. Wishing you healthy legs. See you in the next video.